Well, I have a very interesting background. I went to medical school to become a psychiatrist, and during my schooling years, I became attached to Dr. Richard Troutman during an elective in ophthalmology. He is the chair, was a chairman at the time of ophthalmology at Downstate, and had a course in practical surgery for transplantation. And after seeing the effect of corneal transplants on a patient, I became very excited about being able to restore sight. My days are divided between a day in the operating room doing transplants, and another day I do laser vision procedures, and then the other days are spent seeing pre and post-operative patients. Patients have an immediate response when you take the patch off the first day. Most patients have a wow factor where they weren't able to see anything prior, and then they're able to see very well the next day, and it continues to get better as the patient heals. So the instantaneous response, I think, is very exciting for the patients. I think that the fact that I wanted to be a psychiatrist actually helps me with my practice, because I spend a lot of time with the patients, and it's not just their eyes, it's their whole persona that I embrace and try to help. Patients with visual problems have a lot of emotional distress, and many times I find myself speaking with the family of the patient, their children, counseling them on how they need to adjust their lives, what exactly can be done, giving them expectations that are real as far as what we can do, and it becomes a very emotional experience. Well, one story in particular comes to mind, which is about a young woman in her early 20s who had a disease of her corneas where she wasn't able to see clearly because the corneas grew in the shape of a cone. And she had a young child, and she was at the playground with her young child and proceeded to pick up another child, thinking it was her child, out of the playground, where the parents came, the police came, trying to arrest her for taking the wrong child. So after I did her corneal transplant, she was so amazed at how she could finally see her child for the first time that she never had before.
What is your history with Howard Stein and his wife Gail, and how many of his cornea transplants have you kind of overseen?
Well, Mr. Stein had a number of transplants. A couple of them were done when he was very young outside of the country. And then Dr. Troutman did two of his transplants, and I did his most recent transplant, which was done only a few months ago.